A very good evening to one and all who are present here today for the important symposium on transforming healthcare. I am really delighted that I have the opportunity to be in the esteemed company of eminent personalities on the dais and off the dais, and all the participant students who have worked hard yesterday on the ideas on transforming healthcare through artificial intelligence, biotechnology, digital health, and smart medical technologies. While I am welcoming each one of you to this second day of the National Symposium, I remember our Honorable Patron-in-Chief and President, Dr. Ganpat Patel, whom we lovingly call Dada. Dada is in US right now. A man who is a technologist in many ways, and we call him as father of power electronics because he gave the world power supplies, and he was the one whose power supply made Apollo 11 fly, and he was the one who gave power supply to the first computer, Blue Gene of IBM. And at California State University, Pomona, Center for Engineering Innovation is named after him. It is Ganpat Patel Center for Engineering Innovation. And the Distinguished Scientific Lecture Series is also named after him. It is Pat Patel Distinguished Scientific Lecture Series. Dada has joined online, and hopefully we will hear him. But we have eminent personalities with us on the dais. We have with us Dr. Neeraj Yadav, cardiac electrophysicist, Zydus Hospital. Sir, who doesn't know you, and in the domain that you work in, you are a blessing to everyone. And the ideas, I know you, last 2 days you were coordinating on the topic you are going to speak, and I went through those details, and it's going to be a blessing to the audience today on the area you are going to speak. Thank you, sir, for accepting our invitation. We have with us Dr. Aman Patel. What can I say about him? I am standing here because of him. Thank you, Aman Bhai. And the work that you have done is remarkable in the domain of heart. And we are really fortunate that both these doctors, they have agreed to come because they are hardcore practitioners, and they know where is the technology insertions needed and what is the young generation's view and how they should involve themselves in developing solutions on many of these areas. Thank you, Aman Bhai, for accepting and coming here. We have with us respected Mr. Alok Kumar Mitraji, Deputy Director, Ministry of MSME, Government of India. Sir, thank you very much for finding time, because without government, this is not possible to have a symposium and encouraging the youth to work on such kind of transformative technologies. Government is one of the biggest stakeholder, and you have a big role to play. Thank you for coming and joining us today. We have with us Dr. Pragnesh Vacharajani ji, founder of Hitcon Health Tech. Thank you, Pragnesh Bhai, for accepting the invitation and coming. One of the India's largest pharmaceutical companies, Akum Drugs and Pharmaceuticals Limited, President HR, Shri Arvind Srivastav ji is with us. Thank you, Arvind sir, for coming all the way from Goa and being here. And I was going through the type of work the company is doing, and it's really inspiring with 18,000 employees, and the type of work that your company is doing is marvelous. Thank you for coming here. Online, we have with us Ms. Suzanne Livingston, Vice President of IBM. She has joined us from USA. Dr. Sarju Mohanty, American professor at University of North Texas, USA. He is also there with us. And we have with us one of the most prominent personality in Medical Association, President-elect of Ahmedabad Medical Association, Dr. Kapita Dave. Thank you, madam, for accepting the invitation and joining us today for this important symposium. Having said so, my entire team which is making this happen, and my Director General, Dr. R.K. Patel, Pro Vice Chancellor, Dr. Girish Patel, the entire organizing team comprising of Dr. Praful Baradia, Dr. Ajay Gupta, Sanjeev Acharya, Dr. Hina Patel, and I can go on, but there is a whole team which is working behind to make this happen, and I am thankful to each one of you. While I am welcoming each one of you, I want to begin by talking not about this symposium, but raising a question. What exactly is a hospital in 2026? Is it still a building where a patient goes after becoming sick? Or is it the hospital slowly moving into our homes, smartphones, watches, rings, beds, and even the stethoscope in a doctor's hand? That question, in my view, captures the entire purpose of this symposium. Our theme is transforming healthcare through AI, biotechnology, digital health, and smart medical technologies. And this symposium deliberately brings together clinicians, researchers, biotechnology professionals, biomedical engineers, AI experts, medical device manufacturers, hospitals, startups, policymakers, investors, and students. Because the next healthcare revolution will not come from medicine alone. It will come from the convergence of medicine, engineering, biology, computing, data, and entrepreneurship. The scale of the problem, before we talk about technology, consider this. According to the latest WHO data, non-communicable diseases killed at least 43 million people in 2021, 75% of all non-pandemic related deaths worldwide. Cardiovascular disease alone accounted for at least 19 million deaths, followed by cancer at about 10 million. So the great challenge of healthcare is no longer simply how do we treat the disease. The more powerful question in front of humanity today is, can we identify disease before the patient knows that he or she is sick? And that is where something extraordinary is happening. From the ICU to the wrist, let me give you a few examples, not of the future, but of what is already happening. I am wearing an Apple Watch. Apple Watch has played a role in hypertension detection. In December 2025, Apple introduced hypertension notifications in India. Think about this. A watch that was once designed to tell us the time is now passively analyzing vascular responses over 30-day period, looking for patterns associated with hypertension. The technology was developed using data from studies involving more than 100,000 participants and subsequently validated in a clinical study involving more than 2,000 participants. Apple estimated that the future could notify more than 1 million people with previously undiagnosed hypertension in its first year of availability. So the change is paradigm. The patient doesn't necessarily go to the diagnostic device. The diagnostic device travels with the patient. This is something which is changing. I can talk about another case study, AliveCore, which is an ECG in your pocket. Its CardioMobile 6L can produce a medical grade 6-lead ECG in approximately 30 seconds, while its FDA cleared AI can detect several common rhythm abnormalities. So the new AI-powered Cardia 12L technology was trained and validated on more than 1.75 million ECGs and can make 35 cardiac determinations. A technology that once required a hospital room is progressively becoming portable intelligence. So perhaps the question for hospitals is no longer how many beds do we have. Perhaps it is also how many patients can we intelligently monitor outside those beds. And now imagine the doctor's oldest instrument becoming intelligent. EcoHealth, the AI stethoscope. For more than 200 years, doctors have carried the stethoscope. Now EcoHealth, working with Mayo Clinic, has developed an AI-enabled digital stethoscope. Its FDA-cleared algorithm can help identify low ejection fraction, a major indicator of heart failure, in about 15 seconds during a routine examination. So the stethoscope is moving from listening to interpreting. For the doctors sitting here, this is perhaps one of the most important developments to understand. AI need not replace the physicians. AI can give the physician another pairs of ears, another pair of eyes, and another layer of intelligence. And in India, we are building remarkable solutions too. Dozy, your bed becomes a patient monitor. Look at Indian startup Dozy, D-O-Z-E-E. Instead of attaching multiple devices to the patient, its technology can use a sensor placed under the mattress to capture micro vibrations associated with heartbeat, respiration, and body movement. AI converts those signals into clinically useful information for remote patient monitoring. The company reports deployment across 200 hospitals today in India and have more than 15,500 monitored beds and over 14 million alerts. Think about the possibility for India. We may not be able to put every patient into an ICU, but can technology bring elements of ICU-style vigilance to thousands of ordinary beds? We are seeing the same with an Indian startup Niramai, AI and breast cancer screening with or without radiation. And imagine the impact of such things in rural India. Instead of asking, how do we take sophisticated screening infrastructure to every villages, we can start asking, how do we redesign screening so that sophisticated infrastructure is no longer necessary everywhere? That is innovation. The ultrasound machine is also shrinking. There is another butterfly network, the ultrasound in the hand. And there are so many such examples. One of the group of mechatronics and biomedical students at Ganpat University, they started giving full diagnosis of blood through a photograph of retina. They are trying to improve that technology. There are other groups of students in our university ecosystem who are working with professors in IITs, and they are trying to find out solutions and give such kind of tools in the hands of medical practitioners and the government, so that lot of this effortful job will become effortless and can reach to the last mile, which is our rural India. So when we are gathering here, we are talking about all these startups, we are discussing about innovations. What we have to do is, we have to start putting these questions, and we have to ask hospitals and doctors to give us the problem statements. And these problem statements will go to the universities and research labs. Students, along with professors and along with industry experts, will work on these problem statements, and we will be able to curate lot of solutions for many of these problems which we are struggling with today. So I want to place one warning before this distinguished gathering, that is, technology alone cannot be our destination, because an AI system can be accurate but can still be unfair. So a wearable can be intelligent and still create anxiety. An algorithm can predict disease but compromise privacy. A digital hospital can become smart and still become vulnerable to cyber attack. So while we are going ahead with solutions, we have to keep these realities with us. While we try to find solution, we need to understand that we are open to all these fallacies also. And when we develop solutions, we take care with responsibility of all these innovations. Dr. Tredos captured the balance. Artificial intelligence holds enormous potential for improving the health of millions. But WHO also cautions that technology can cause harm if it is not governed responsibly. So while I am welcoming each one of you to this symposium, and we look forward to hearing the experts in the domain and all the startup ideas who are here in this room, who have worked hard for months, and yesterday you participated in a great evaluative event. While you are listening to them and working on your projects, you must try to take this as the basic foundations. And why this conclave will matter is because this program has brought everyone together. This is rare opportunity when students, researchers, practitioners, policymakers are in one room, under one roof, and they are talking in the same line, sharing their experiences and expertise, which will make lot of meaningful contribution to these projects which these students are working on. On this note, I welcome you all, and I am really hopeful that this conclave will lead to many solutions we look forward to. Thank you.